Welcome everyone again to the University of New Mexico Law and Mental Health Series, weekly discussions of practice and science featuring experts in behavioral health and the law. This series is run by the Division of Forensic Behavioral Sciences of the University of New Mexico's Department of Psychiatry and Behavioral Sciences, in support with the New Mexico Behavioral Health Services Division. I'm Anthony Perillo, and I'm the Forensic Psychology Training Director here at the University of New Mexico. For our talk today, if you have any questions for our presenter, make sure you enter them in the Q&A box. You can enter those anytime you feel comfortable, but do know that we hold questions until the end. We often are not able to get to all of the questions as well, as a heads up. If you are pursuing continuing medical education credits, there will be a sign-in sheet posted in the chat box shortly. If you're pursuing APA continuing education credits, the link for the survey you'll complete to get your credits will also be in the chat box, but near the end of the presentation. So keep your eye on the chat box around the hour, somewhere between 50 minutes or 55 minutes to the hour for that. Make sure that you bookmark the link or copy the link if you're not going to open it during the survey, and make sure you save your PDF of the certificate after you complete it, because we don't have access to those completed certificates after the fact. If you missed last week's talks in the series, Dr. Mark Martinez's discussion of risk management considerations and forensic evals is now available on our YouTube channel. The recording for this week's talk should also be available on our YouTube page later this week, and the PowerPoint slides will be accessible for people registered for the series later this week as well. As a heads up, next week we have Dr. Troy McEwen, who will be discussing recognizing and assessing stalking. But circling back to this week, I'm thrilled to introduce you to today's speaker, who will be discussing psychopathy assessment in forensic settings, including some considerations toward a dimensional assessment perspective. This is Dr. Jaime Anderson. Dr. Jaime Anderson is an associate professor of psychology at Sam Houston State University. She completed her bachelor's in psychology in German at the University of Dayton and her master's in clinical psychology at Eastern Kentucky University. She then earned her PhD in clinical psychology from the University of Alabama, where you had a specialization in psychology and the law, and completed her pre-doctoral internship at Patton State Hospital. Her research focuses broadly on the assessment of psychopathology, with much of her work emphasizing the assessment of personality disorders. Dr. Anderson is an associate editor for the Journal of Psychological Assessment and has published over 60 papers and book chapters in the areas of personality psychopathology, broadband assessment, and in forensic psychology. She's also a licensed psychologist in Texas and maintains a private forensic practice in which she primarily conducts competency to stand trial, mental state at the time of the offense, and mitigation evaluations. So Dr. Anderson, Jaime, on behalf of the University of New Mexico, thank you so much for joining this series. And we're very excited for you sharing your expertise with us today. I'll go ahead and toss it over to you.
All right, thank you so much. Good afternoon, everyone. So as Anthony mentioned, I'm going to be talking a little bit about psychopathy in forensic settings, specifically in risk assessment settings, with a particular emphasis on alternative diagnostic systems of diagnosis. So this is your CE information. If you want to take a quick screenshot of that, that is there, but I believe that's also in the chat there. As a disclosure, I do not have any sort of financial benefits that come from this content whatsoever. Also, the views that I'm going to talk about today are my views and not the positions of the University of New Mexico. And so here's kind of an outline of what I'm going to be talking about today. And I'm going to be honest and say that I'm going to bring up some issues and questions that I don't necessarily have perfect answers and solutions for. But my goal is to first sort of talk about the current scientific state of psychopathy and some of the disconnect between the science of psychopathy and the practice of risk assessment. I'm going to introduce a newer or upcoming model that I think has some potential for better utility and better unity in the assessment of psychopathy. And then I'm going to end with some thoughts on forward-thinking movement and hopefully some practical advice as well. So I hope that you can kind of leave this talk with some knowledge about psychopathy and some knowledge about some movement in the field to change the way that we think about personality disorders. And for me, this comes with some dissonance about how we think about psychopathy in risk assessment settings. And so I might accidentally transfer some of that to you, and I apologize for that. But hopefully we can also have some good thoughts and maybe some discussion at the end about how to better integrate science and practice in this field moving forward. And so I want to kind of start with a conversation about psychopathy and where we're at with psychopathy, sort of broadly speaking in the literature. And as many of you probably know, in the early days of the DSM, antisocial personality disorder was introduced in DSM-1 actually as a proxy to capture psychopathy in the DSM. But then when DSM-3 came along, there were these efforts from the DSM to kind of move and improve reliability in diagnosis, right? To kind of better standardize the diagnostic process. And with that, we got all of these largely behavioral symptom counts that we have today. And so what this meant for antisocial PD, though, was that it became a behavioral disorder and it started to lose many of the curatorological features that I think we associate with psychopathy. And it sort of solidified this disconnect between what antisocial personality disorder is and our diagnostic, our sort of formal diagnostic system, and what we think about when we think about the construct of psychopathy. Because of this, psychopathy is basically conceptualized, measured, studied as a largely separate construct, right? Outside of any sort of formal diagnostic system. And this has given the field a lot of flexibility in how it's conceptualized and measured. But also, and I'm certainly not a DSM enthusiast by any means. If you know me well, then you know that. But that for better or worse, it, not having this in the formal diagnostic system sort of means that there isn't always necessarily unity about what we're talking about when we say the word psychopathy. And psychopathy is actually a pretty contentious field. Many of you are maybe aware of this. You don't have to dip your toes too far into that water to sort of get a taste of that. And there are large disagreements about what psychopathy is, what it is not, how we should measure psychopathy. And some of those disagreements sort of center on, whether or not even criminal or antisocial behavior is important in its conceptualization, what we do with sort of the positive qualities that we sometimes associate with psychopathy, things like a mask of sanity, or what some would call boldness, and how important or relevant that is to the construct of psychopathy. Whether psychopathy is one thing or many things, and even whether psychopathy is really a diagnostic or a unitary construct at all, are all kind of on the table in terms of the controversies. But most, and it's hard to generalize, I think, in this field, but the sort of predominant view of psychopathy is that it is a constellation of traits made up of, it's a constellation of traits with potentially heterogeneous variance, right? That there are potentially different ways that we can sort of get at this one construct, depending on the traits or symptoms that a person demonstrates. And even though there are a lot of disagreements about what those traits or qualities should be, we've kind of moved away from this idea in the field of psychopathy that psychopathy is one thing, and most would argue that psychopathy is actually made up of varying problematic traits, which is actually a lot more consistent with broader movements in the field and the broader understanding of personality psychopathology, which has been moving towards dimensional models. And again, it's kind of hard to generalize, but the most agreed upon core feature of psychopathy is probably meanness or callousness, lack of empathy, and the other traits, kind of the antisocial or criminal behavior components versus boldness, right? That these kind of fall into slightly more contentious zones. And I don't want to go into too much detail about the varying different types of conceptualizations of psychopathy, but there are a multitude of models. Most of us are well aware or familiar with the PCLR, and we're going to talk more about that. That gives you your total score and your two-factor scores, your four-facet scores. The PPIR, the Psychopathic Personality Inventory, was developed actually for community non-criminal use. It also gives a total score, two-factor scores. The triarchic model is probably and that's this one up here on the right, is probably the most consistent with sort of broad movements in the field, with dimensional conceptualization of personality disorders or dimensional conceptualization of psychopathology more broadly. But it basically suggests that psychopathy is this combination of a few broad personality domains: boldness, meanness, and disinhibition. And that each is sort of relevant to psychopathology in its own right, but that together they make up something that we would call psychopathy. the dark triad on the top left is really the only one here that treats psychopathy as truly only one thing, as a unitary construct with one scale to measure it. And then most recently, the comprehensive assessment of psychopathic personality, or the CAP model, was actually introduced in an effort to create some unity in the field. It conceptualizes psychopathy as unitary, but suggests that psychopathy is this combination of varying traits, qualities, symptoms across different areas. And this is, by no means an exhaustive list here. And I'm not going to go into the ins and outs of all of these different models, but I think the point here is that there are a multitude of different ways to assess psychopathy. There's disagreement about what should and shouldn't be in these models and measures. And that when we're assessing psychopathy in any sort of context, and I think, risk assessment context, forensic context is included here, that we should have some clarity about how we're conceptualizing this construct in the first place. And, we in the field of forensic psychology and in risk assessment, we have placed psychopathy in this place of prominence in these types of evaluations, that it's sometimes, I think, seen as almost like a magical construct, right? That it's like the smoking gun in risk assessment, that like, oh, if someone meets this threshold of a 30 on the PCLR, then, I got you, right? Like this is high risk, this is magical, right? In some sort of way. And, we have some agreement in the field that ASPD, or antisocial personality disorder, its diagnostic counterpart, is also not considered particularly meaningful for our context, right? Much like the field of psychopathy, we've essentially abandoned this in the DSM and largely pretend that it doesn't really exist in these types of contexts. And there's a reason why we focus so much on psychopathy in these evaluations. And a lot of that has to do with the literature based on psychopathy, that individuals with psychopathic traits account for a disproportionate amount of criminal behavior and violence, that there's a decent literature base on the PCLR specifically, that our measures of psychopathy are associated with higher rates of recidivism and antisocial behavior, right? That there's some sort of predictive utility in assessing psychopathy. And that is why we have sort of placed it at this, almost on a pedestal from time to time. And even though we put a lot of emphasis on this as a construct, we have really done so by focusing only on one measure, that there is this one measure that sort of triumphs over all others in risk assessment contexts. And of course, that is the PCLR. And I have here that this is the gold standard. And I think we could argue, and I'll talk a little bit about, how gold this standard really is, but but for better or for worse, this is what we use, right? Almost, maybe not exclusively, but overwhelmingly, we are using the Hare PCLR. And as I mentioned, this is a measure that gives us a total score. It also breaks psychopathy into two different factors. Factor one being these sort of affective and interpersonal qualities that we associate with psychopathy, and factor two being the behavioral components of psychopathy, broken down into the lifestyle and antisocial facets. And there are some good reasons why we use this measure in the field. It requires a thorough evaluation where, we have to interview. The interview for the PCLR is relatively lengthy. It requires a record review, potentially getting some reports from informants or staff or whoever. And I think it also sort of jives well with general forensic practice, and that we put a lot of our emphasis on external data. And I think the PCLR does too, right? That we're not relying exclusively on an individual's self-report. And I think particularly in a risk assessment context, and particularly when we're assessing something like psychopathy, there might be some hesitance to rely solely on self-report for a variety of reasons. And then finally, there's, although this doesn't generalize to all risk contexts, there's certainly in many risk contexts some research that demonstrates good predictive utility of the PCLR, that we can use the PCLR to predict future recidivism and future risk in these contexts. I said we get to this argument about how gold this standard really is, and I think there are many limitations to the PCLR, both conceptually and in practice. First, we have this somewhat arbitrary cutoff of 30 to denote psychopathy, right? That once we get to 30, that this person is a psychopath, right? That if they had a score of 28 or 29, they're not a psychopath, and then suddenly they reach 30 and they are. And that's not really consistent with what we know about really any sort of psychological disorder, but psychopathy included. There's also a multitude of field reliability problems that have been identified in the literature, that there's bias in ratings, that psychopathy ratings on the PCLR sometimes will tell us, as much about the evaluator as it does about the evaluee. That there are some subjective ratings. I think that, factor one is particularly susceptible to this. If you think about, our ratings of how glib we find someone, that's a little bit subjective, and it's harder to rate that and many of the items on factor one than it is to rate something like criminal versatility that we could oftentimes rate with records alone. And somewhat related, I think, to this issue is that the behavioral ratings, or the factor two ratings on the PCLR, are actually far more predictive than factor one. And so, on one hand, I think that this is a good thing, that we have probably better reliability. It's easier to rate factor two, and those are the things that are most predictive. But if we return back to the science of psychopathy more broadly, factor one scores are kind of considered more to the core of the construct by many people in the field. And so it kind of raises these questions about what are we assessing, and are we putting emphasis on what most people would say psychopathy really is? And because of many of these, particularly the field reliability problems, there have been a lot of arguments for a while, but especially more recently, against using the PCLR in many different contexts, right? That many people have said that we shouldn't use it at all. Some have said that we should stop using it in high stakes decisions, things like death penalty cases. And that there have been some calls to, sort of not assess for psychopathy at all, right? That we should sort of stop assessing psychopathy entirely. And I think if we, retain some focus on psychopathy in these evaluations, we do have to kind of contend with the fact that the field of psychopathy is a little bit of a messy business, right? That there isn't this unity about what psychopathy is. And when we tend to equate psychopathy with the PCLR in the field, there's a bit of a disconnect there, I think, with how the field of psychopathy sees things, and sort of the lack of unity that actually exists in the field. And so I think we have somewhat of a science practice problem in assessing psychopathy. That we treat it as one thing, as I mentioned. We frequently ignore the multidimensional aspects of the construct, right? That we rely on this one measure, we rely on this one score sometimes, right? I think there's increased use of factor facet scores, and we're better off for that, but we are still relying on one measure, one conceptualization of the construct. And then in addition to that, I think, again, we have this issue of, we put a lot of emphasis on psychopathy, but the most predictive aspect is factor two, which is largely behavioral and considered less core by some in the field. And so it's almost, similar to the issue that we have with antisocial personality disorder, right? That we don't like that diagnostic construct because it's too behavioral, and that we feel like it doesn't tell us very much. And here, I think we rely a lot on the behavioral components that we get with the PCLR to predict recidivism. And to some extent, I think maybe that's okay, right? That if it's predicting recidivism in a way that is helpful, then so be it, right? But if we are most interested in psychopathy broadly, then I think we have to consider whether or not, everything that we're assessing is characterological, and whether we're most interested in psychopathy or more interested in these behavioral indicators. And as I mentioned, I don't necessarily think that there's any sort of magical solution. And I'm going to talk about the alternative model for personality disorders, and I don't think that it's our savior by any means, but I do think that there's a potential future path in considering, some of the lack of unity in the field of psychopathy, and also potentially a more consistent approach that has the potential to be formalized in our diagnostic system as well. And so we're going to move into the alternative model for personality disorders in the DSM. And before I get into the nitty-gritty details of this model, I think it's important to zoom out and talk about this in a broader context where there is a larger movement in the field of psychopathology more broadly to conceptualize mental health disorders as dimensional and hierarchical, to move away from our categorical system of diagnosis, that we are not really carving nature at its joints, and that, you know, what the research says psychopathology looks like is not consistent with what we have in our diagnostic manuals. And personality disorders have been particularly problematic, especially since the DSM-3, when we made this huge move towards sort of creating more behavioral criteria for our psychological disorders. And so we moved to the system that was more behavioral, and we focused on categorization that doesn't really fit people. And we have a lot of diagnostic overlap, right? If you think about the diagnostic overlap between something like borderline personality disorder and its overlap with antisocial PD, or its overlap with histrionic PD. Antisocial PD has a decent amount of overlap with narcissistic PD, right? That there's a fair amount of diagnostic overlap between diagnoses. And then within diagnoses, there is also a problem where we have a great amount of heterogeneity within one particular diagnosis, right? That someone with BPD or someone with antisocial PD or what have you can present very, very differently. And then kind of more broadly, this system is just not very consistent with what the literature base says personality psychopathology really is, right? That when we think about personality psychopathology, we oftentimes think about these disorders being extreme variants of normal personality, but that's not really what's reflective in our diagnostic manual at all. And so the alternative model for personality disorders was developed as this more empirical alternative for diagnosis. And it's actually a hybrid model. So they recognize that sort of switching entirely to a completely different model when we sort of know and love these various categorical diagnoses might not translate well into clinical practice. And so it's actually dimensional and categorical. So it has multiple components of the model. It has criterion A, which assesses impairment criteria. I'm going to show you a slide in just a second that gives you more detail here, but that focuses on impairment criteria. Criterion B focuses on pathological traits. And then the combination of these various functional impairment areas and the severity of those, plus the presentation of pathological personality traits, makes for a personality disorder diagnosis, which they organize into 6 different categories that are called, you know, our familiar personality disorders: borderline, antisocial, narcissistic, etc. And so here's kind of a visual representation of the model, where you have criterion A is essentially the severity of the personality dysfunction. This is, you know, does the individual, and to what extent does the individual have impairment in self and interpersonal functioning, or self and other functioning, right? And we assess this in these areas of identity, self-direction, empathy, and intimacy, right? That actually many people would say that personality disorders are just as much about interpersonal functioning as they are about personality, right? That there's been some people calling to call them interpersonal disorders actually instead. And this kind of stems from that, right? That we should see some sort of demonstration of impairment in either who they are or how they interact with other people. And that's kind of the severity, how that impacts them is the severity of their personality dysfunction. And then criterion B is meant to be the style of dysfunction, right? That we know that they're having problems. And in criterion B, we get to denote where these problems are coming from. And this is actually the piece that is most consistent with this broader literature on personality, largely stemming from research on the 5-factor model, where, you know, we have this 5-factor system that is kind of extreme variants of normal personality, right? Where you have negative affectivity is kind of your extreme variant of neuroticism. Detachment is the extreme or the pathological opposite of extroversion. Antagonism is your pathological opposite of agreeableness. Disinhibition, the pathological opposite of conscientiousness. And psychoticism doesn't really map onto openness exactly, but it is important in assessing personality psychopathology nonetheless. And then, as you can sort of see, under each of these various domains, there are a set of trait facets, right? And if you've ever given a NEO or something like that, right, then this is a relatively familiar model, right, where you have these facet scores underlying these broad personality domains. And these facets are actually kind of our symptom level data, right, where we're using these facets to denote whether or not or how someone has a presentation of personality psychopathology. So for borderline personality disorder, for instance, we're going to be looking for traits that fall in the, largely at least, in the negative affectivity and disinhibition domains, right? And I don't want to go into too much detail on these various measures, but there are measures that exist and for the most part are pretty well researched in the field that are available for use. And actually many of them are free for use. They were published, some of them with the DSM. And there are both self-report and clinician-rated interview forms for both measuring impairment in the system and also for assessing pathological traits. And so to return to our issue of psychopathy, this is what antisocial personality disorder looks like in the model. So for criterion A, or the impairment criterion, we're looking for some combination of issues across self and interpersonal functioning, things like, goal setting based on personal gratification, a lack of remorse, not being able to form good intimate relationships with other people, or if you form intimate relationships with other people, then you're likely to be exploiting them in the process. So we're looking at sort of some of those indicators of impairment in their functioning. And then to sort of get the style to denote that this is an antisocial sort of problem, we are looking at a variety of different personality traits or pathological traits that include manipulativeness, callousness, deceitfulness, hostility, risk-taking, impulsivity, and irresponsibility. And, first, the model itself is a huge attempt to move away from behavioral indicators and to measure something more characterological. That's kind of the overarching goal of the AMPD more broadly. And this is really what was always intended in personality disorder, right? That we never intended for our personality disorders to be based on these behavioral indicators that we see now. But that in the system, we in the AMPD system, we're kind of returning back to what the original purpose was and trying to focus more on those types of issues. But looking specifically at antisocial personality disorder, I think even at first glance, when we take away some of these behavioral indicators, we're kind of moving away from assessing basically whether someone has gotten into trouble, which is, I think, what we get with antisocial personality disorder a lot of the time in our current system. But we move into focusing on broader qualities of the individual that I think even at first glance, conceptually, are a much better match with the construct of psychopathy. And actually, the research tends to support this too, right? That this is kind of zooming out on some of the broad research on the model, but that the AMPD, the trait model in particular, has a decent amount of research on its ability to assess psychopathic traits. And essentially, it has shown that this model does include symptoms and traits that are consistent with psychopathy. And that was always the goal, right? That if we think about psychopathy as a personality disorder and something that is not really separate necessarily from these other personality disorders that we have in our system, we want a broad-based model of personality dysfunction to also include psychopathy in its measurement. And notably, this is not an exhaustive list of the studies, but this is a few of some of them. And these studies have used multiple different models and measures to conceptualize psychopathy. And so the benefit of this is that we're getting a model that not only assesses one, sort of variant of psychopathy, but that we are getting multiple models that fit in here, that regardless of how you sort of conceptualize psychopathy, you can basically conceptualize it using this model, whether you're a PCL enthusiast or you like the triarchic model or you like the PPI or whatever it is, right? That you have some ability to measure those same traits and characteristics of an individual using the AMPD model. And more specific to antisocial personality disorder, research has been pretty positive there as well, that antisocial personality disorder in the AMPD model outperforms the current system, the current ASPD or antisocial personality disorder in the DSM in measuring psychopathy. So it's a huge improvement in assessing its original target, right? With many people making an argument that we have actually returned to what the antisocial personality disorder diagnosis was originally intended for, right? Of course, it's probably not first, it's probably not surprising that we have improvement. No one is a big fan of the antisocial personality disorder diagnostic construct, mostly, and so there was a lot of room for improvement, and so pat on the back for getting improvement there. But we also, it's probably not surprising either that a lot of the improvement comes from measuring the affective and interpersonal qualities of psychopathy rather than behavioral components. We were actually doing a pretty good job of measuring the behavioral components with sort of section 2 or the original antisocial personality disorder diagnosis. But we see a large amount of improvement in measuring perhaps what we were missing, right? That we were missing these affective and interpersonal, these sort of characterological components of psychopathy, and we have found them, right, in this new sort of system. We also tend to see global improvement, right? The total scores are also improved by using the AMPD. So, and similar to the last slide where I showed different papers, these papers that I show here also are assessing psychopathy in a multitude of different ways. And so, again, I won't go into like all the varying different papers here and what each of them did, but that it's demonstrating that no matter how we slice and dice psychopathy, that we do have improvement for the most part when we are using the alternative model for personality disorders over this previous system for antisocial PD. And, I do think that I've made this argument that this is a more unifying diagnostic approach, and I do think it is. But I think the world of psychopathy tends to thrive a little bit on some contention, and so we have a bit of spice, I think, to add here as well. And that is the psychopathy specifier in the alternative model for personality disorders. So in this system, we not only have a categorical diagnosis of antisocial personality disorder that is made up of functional impairment plus these broad areas of pathological personality, but they also added a psychopathy specifier that by their definition is characterized by a lack of anxiety or fear and by a bold interpersonal style that may mask maladaptive behaviors. And so it kind of focuses on one of the more contentious areas of psychopathy, that is boldness. And it actually seems to do a decent job at assessing boldness, but it does map onto boldness nonetheless. And it does so by assessing this in terms of attention seeking, low anxiousness, and low withdrawal, with kind of its stated, that its target construct here is this bold interpersonal style. And this has brought about a decent amount of controversy in its own right for a variety of different reasons. First, and I think that this is important, that The biggest proponents of boldness don't really think that they've measured boldness in the ideal sort of way, and have suggested that some other traits may be more useful in assessing boldness. And so it does a decent job of assessing boldness in the empirical literature, but that they could have done it better, that if that is our target. In addition, this specifier, even though I think, the idea of it is great, this idea that, hey, we have a way to sort of formally denote that someone has a psychopathic personality, and we have this ability to differentiate between antisocial personality disorder and psychopathy in our diagnostic system. Yay, that's great, right? But this specifier suggests that boldness is potentially the differentiating feature between psychopathy and antisocial personality disorder. And not only is boldness a more contentious sort of area of psychopathy, but also the most agreed upon core of psychopathy is meanness, as I discussed earlier. And so that presents a little bit of problem there too, that if we're going to try to differentiate between antisocial personality disorder and psychopathy, and I don't personally necessarily think that we need to, but if we do want to, that probably we should focus on what the core of psychopathy is there, right? Adding to that, when we look at research on the specifier actually does very little to augment the prediction of global psychopathy scores. It seems to be pretty exclusively associated with boldness. It's not really associated with other areas of psychopathy. It's not really associated with measures of psychopathy that don't include an assessment of boldness. And in some cases, it is actually negatively associated with other areas of psychopathy, and certainly with other antisocial PD traits in the AMPD. So, we have the AMPD, I think, as a whole provides a unifying structure, right? That the ASPD diagnosis in the AMPD is a huge improvement in terms of capturing what we wanted it to do in the first place, which is assessing psychopathy. But the psychopathy specifier, I think, is maybe, I'm less optimistic about that. I don't think that it's probably going to be particularly helpful, especially in risk assessment context, right, where we are sort of focused on these broader, the behavioral components of psychopathy there. So I don't think that we have a huge savior or anything in the specifier. But I do think that there are some things that can be applied from the AMPD when we think about risk assessment. I think if we put that specifier aside and we sort of ignore it for a second, we do have this model that better accounts for various operationalizations of psychopathy in one system. We also have a diagnostic construct of antisocial personality disorder in this model that is probably far more clinically useful, and probably far more relevant to use in risk assessment context, right? And we also have it potentially moving into a formal diagnostic system, right? That this is kind of up in the air, but if this becomes the formal diagnostic system, then suddenly we have a diagnostic construct in the DSM that might actually be relevant for these sort of risk evaluations. Though admittedly, the research in this area, in terms of application of the model in risk assessment settings, is pretty scarce. And so where do we go from here? We've established that psychopathy is messier, I think, than what we give it credit for in the field of forensic psychology. We've established that there are potential problems with the PCLR beyond just sort of focusing on it in a sort of singular fashion, that there are potential problems with the measure itself. I've also introduced this system, this sort of alternative system of diagnosis that seems to be a big improvement from a formal diagnostic system. But that there's a bit of a tug of war problem, I think, looking at the future here, that the PCLR is imperfect in many different ways. The AMPD offers some benefit, and it's more consistent with the literature, right? I think that it offers some ability to better unify the field of psychopathy, right? That at least varying conceptualizations of psychopathy are here in this one model, along with other sorts of personality traits that we might think are really relevant. I think that it allows for us to assess for other areas of personality psychopathology that could be relevant in risk assessment, right? That we think about like BPD or something like that, or reactive aggression or negative urgency, things like that are better represented in this model broadly that we sort of miss when we focus exclusively on psychopathy. But these arguments about what psychopathy is or what psychopathy is not still remain in this system. And so I think that's something that we have to contend with. And I think perhaps most important from an application standpoint, there's pretty limited work on actually evaluating risk using this model. There is one study by Antonella Soma that was published a few years ago that does look at the alternative model for personality disorders in forensic contexts. And there are a variety of sort of opinion or theoretical papers that focus on how we could potentially do this, or what traits in this model might be relevant, or how it might offer some improvement. But I think when the rubber meets the road, right, we want to have some actual data here, right? And I think nothing, at least at this point, is going to rival the PCLR in terms of recidivism or use and risk assessment until we actually have that sort of research literature that demonstrates that the AMPD might be helpful. And so I think at this point, it is unfortunately a little bit of a conceptual argument more than probably, I'm not trying to pry the PCLR out of anyone's hands at this point, certainly. And so I think that there are some question marks about this moving forward. I think we have it's very possible or likely that the field is going to continue moving in this direction, right? That when this becomes a primary model, exactly what it looks like is very much up in the air. But we're probably going to continue to move in this direction for diagnosis. That actually the ICD 11 has actually already moved to this sort of system where they have a very similar dimensional system focused on impairment and to a lesser extent pathological traits in assessing personality disorders. So they have actually done away with most formal personality disorder diagnoses and instead are focusing entirely on these areas of assessment and pathological traits. And so we're probably going to move in that same direction as well. And I think that there's some benefit to this, huge benefit to this. And one of those is that we have this opportunity to bring psychopathy back into the broader conversation of personality disorder. And I think there's big benefit to that. And we also, like I've mentioned, have some potential for unity, right? That this model seems to be more inclusive than some other models or measures of psychopathy. But then I think we have some things that we have to work out in the field of forensic psychology when and if we do continue to move in this direction, right? That if this becomes the formal diagnostic system, I think, if we assume that we are still interested in measuring psychopathy and risk assessment, then first, of course, we need some more research demonstrating that this can work, right? It would be a little hasty to throw out the PCLR without establishing that the AMPD is a reasonable model, right? That this can function similarly in terms of predicting future risk. And I think there's a bit of a question mark there, right? I think we also have to consider acceptance in court. This probably becomes a lot more straightforward if it becomes the primary diagnostic system. Currently, it is available, right? You can use it. It is in the DSM. It is in the back of the DSM as an alternative model for personality disorder diagnosis that you actually can use. But most people have never heard of it, right? And so from that point of view, I think it's currently maybe a little bit more tenuous in terms of its acceptance for use if we were to go in saying that we use the alternative model for personality disorders to diagnose someone. Even though it might be more empirical standing, I think its lack of popularity in the world probably isn't going to do anyone any favors. And then I think the other thing that we have to do is figure out how to make this palatable to our audience. It's certainly more empirical, and I think the fact that it is more complex shouldn't mean that we don't use it, right? It's a better system in many ways. Certainly, it's a far better system than the personality disorder diagnostic system that we have right now. A bigger question mark about whether or not it's better for risk assessment purposes. But if we do move in this direction and we do decide that we want to start using this type of model in these contexts, it is a little bit more complex. I think even describing it to psychologists and graduate students, I sometimes get this like, huh? kind of reaction. And again, like, I don't think that that's a reason not to use it, but I do think that it takes some thought in making sure that we are explaining it to our audience and how we derive these diagnoses in a way that is understandable and not too convoluted for our target audience. And so I've, made a lot of hypothetical open-ended questions here, or posed a lot of hypotheticals and open-ended questions. And so I would like to kind of wrap it up with a little bit more practical application of what I think we can take away from this. First, I think, this is an FYI of sorts, right? That the psychopathy literature is not all that consistent with how we think about it in the field, that there is this new system, right? But if we want to think about, well, what do you want me to take away from this in terms of clinical practice? I think first, this is a little bit lofty, but it would benefit us to become more familiar with the broader psychopathy research base when we're making decisions that involve that when we're making decisions in risk assessment, that if we're going to focus on psychopathy as a construct, right? If we're going to make decisions based off of psychopathy, then we should probably have a decent understanding of the broader psychopathy literature to help us in making those sorts of decisions. I think that also includes probably keeping an eye on progress with the alternative model, that this might be coming down the road. It's unclear when or how quickly we will move to this sort of model. But if it does happen, right, it would be important for us to have a good understanding of what this is going to look like in future iterations of our DSM. And then I also think that we could benefit from having multiple sources of data, right? That if we're truly interested in psychopathy, there are other models, measures that assess symptoms and traits of psychopathy. I think, if you're already using an MMPI or PAI in risk assessment practice, I think that you already have some symptoms and traits there that you're assessing that are relevant to psychopathy. And there are also a multitude of additional psychopathy instruments that could supplement your understanding of psychopathy or your understanding of psychopathy in the individual that you're evaluating using other measures. The CAP, for instance, the Comprehensive Assessment of Psychopathic Personality, is fairly new, and it doesn't have a huge literature base, but it does actually have clinician rating scales, right? That they kept an eye on sort of using this in actual clinical practice, which has some benefit. And relatedly, there's this recognition that I think is necessary that the PCL is only one measure of psychopathy. And again, like, I don't think that this means that we should stop using the PCLR necessarily, right? I mean, there have been calls towards that. That's not necessarily the argument that I'm making here. That's not my intention. But I think recognizing that the construct is just one measure, right, of this construct, and that it doesn't represent the entire body of work in this area, and that it, of course, has some other limitations. And sort of finally, and I've alluded to this a little bit throughout this talk, and I guess I can't help myself but end this on sort of another hypothetical or big question mark, but I think we should also consider what we are assessing with the PCLR and what is most useful in our PCLR assessment, right? That we're kind of at this crossroads in PD diagnosis, that we have this opportunity to take a step back and look at what we're doing and what we're most interested in. And I think if we truly want to focus on assessing psychopathy, maybe there are better ways for it in the future, right? Things that have measures or models that have fewer problems. But if we're really only interested in factor 2 scores, then perhaps we reckon with the idea that we're not so singularly focused on psychopathy anyway, right? And that this disconnect between science and practice is really in name, right? It's that we're calling it this global construct of psychopathy when we are most interested in these behavioral indicators. And I don't have like huge excellent answers to that question, but I do think it's something that we should think about as a field. And ultimately, I think to answer it well, we probably need more data, right? We need more data on other models and systems of psychopathy and risk assessment context for us to really answer the question of whether or not we're focused on something beyond psychopathy, or at least a subset of psychopathy, I guess I should say, within our PCLR administrations. But I think it's important in both fields, right? In the field of risk assessment and also in the broader psychopathy field, to sort of consider paths forward to provide greater unity between science and practice. In my opinion, maybe if it proves worthwhile, if the data pans out, maybe the AMPD is part of that, or some other alternative system of personality disorder diagnosis is part of that. But I do think that there are probably some open questions that remain about how to best conceptualize, assess, and what weight we should put on psychopathy in our risk assessments. I believe I have plenty of time for some questions, and I will actually, maybe it's most helpful for me to put that up on here.
Yeah, sure thing. Thank you so much, Jaime, Dr. Anderson, for a very thorough and helpful overview. I see one comment on here saying this is the best I've seen in clarifying and comparing, describing psychopathy in detail. Thank you, clearly presented without jargon, very easy to follow, very thorough, very helpful. Thank you so much for all the work you do in this area and sharing all these different perspectives on psychopathy and psychopathy assessment with us. We do have a number of questions. Feel free, everybody, to enter them in the Q&A box. If you have any additional questions, I will give you a heads up. It will not be possible to get to all of them. People have a number of questions already, just demonstrating the engagement here. There is a QR code up for if you want to access the APA CEU survey. Shortly, in the next couple of minutes, the chat box will include a direct link for you to click or copy and paste for a later date. Someone asked if you would consider the categorical component of the dimensional categorical model more of a political compromise or more of a recognition of, as they describe, light being both a wave and a particle. They're getting at this idea of how much of it, assessment for practical purposes versus scientific accuracy. And how much of this do you feel is more about practical salesmanship of the model to practitioners versus what is actually cutting at the core of science?
Great question. So I don't know if I would go as far. There's probably some political components to this and salesmanship or whatever, but I also think that, as much as it's political, it is also extremely practical, right? That if we do away with this entire system and we don't have kind of a crossroads, that it can create an issue in clinical practice, right? That I'm not a big fan of any of these categorical diagnoses. And in fact, moving forward, I would like to see them done away with entirely, right? That if I were to fall anywhere on that line, right, kind of as this person is asking, like, no, I don't necessarily think that we need all of those categories, and that the model is more useful in many respects without them. But, even as a researcher of this model and a big believer in the system, I too use terms like borderline personality disorder and narcissism and all these other things. I think that these are just like everyday language for clinical psychologists, and that it could be to our detriment a little bit to get rid of them entirely and not have at least a crosswalk, right? And that's kind of how I think about them, is that the traits and the impairment are more important in this model. But if we want to sort of create this connection for clinicians or for clients who are diagnosed with these disorders, it's nice to sort of have this way to demonstrate, like, hey, yeah, you've been diagnosed with BPD for years, and this is what it means in this new sort of system. And of course, this isn't so relevant to forensic context, but I think the other thing is insurance, right? that actually the ICD-11 kept one categorical personality disorder, and it was BPD. And some of that had to do with access to care and making sure the people who had these diagnoses were not stripped of their access, because insurance companies would have no idea what to do with this system, I think.
Certainly. You mentioned the problem with antisocial personality disorder as a diagnosis being primarily behavioral, but also that recidivism is most predicted by the behavioral aspects of psychopathy, at least as measured by the PCLR. Does one of these outperform the other, the PCLR versus a diagnosis of antisocial personality disorder behavioral aspects? Is there some benefit to using one over the other?
Yeah, so I think that there's certainly benefit to using the PCLR over antisocial personality disorder as a diagnosis. It's somewhat of an unfair comparison because if you're looking at a diagnosis of antisocial personality disorder, you're looking at a checkbox of symptoms, versus in the PCLR, right? We have this really thorough interview and we have this thorough record review, and it's all laid out. Um, and we don't assess antisocial personality disorder in that way. And so to some extent, I think it would be an open question mark. I think that we would, if we were to assess antisocial personality disorder in a similar way to how we lay out the PCLR, I think it's possible that there wouldn't be as much added there, because past behaviors predict future behaviors, right? And if we were to focus on the past behaviors that we get, that are kind of the basis for antisocial PD, we would probably see a lot better predictive utility in that diagnosis as well. But it's not really how we currently evaluate antisocial PD. So
Sure. We have a number of people that assess youth in the audience here, and so a couple of people have asked something related to how these current views of assessing psychopathy among youth and the use of the PCLYV, the youth version in risk assessment. How does AMPD relate to youth?
So I will admit that this is not my area of expertise. I am not an adolescent personality psychopathology researcher. But one of the ideas behind the AMPD is that this should not be restricted by age, right? That we know that antisocial personality traits, psychopathic traits, borderline personality disorder traits, that it's not like you turn 18 and suddenly there's something different there. And I think that there's probably some opportunity for unity in that system as well. I also think, and this is again an open question and somewhat speculative, but there's potentially some opportunity for reduced stigma in this system as well, right? That if we do away with these diagnostic labels, I think particularly with youth, if you don't have to put borderline personality disorder or antisocial personality disorder, or say that they have psychopathy in someone's chart or in a report, that there could be some added benefit there as well. But that's mostly speculation.
Other group differences of assessment that people asked about: gender issues. Someone asked, do critics discuss potential gender social issues with how psychopathy specifiers focus on boldness? The way it's described here makes me think of how men tend to be socialized in comparison to women. This person says they feel like there's an enormous relational, affective, exploitive component missed in that specifier.
Yes. So I haven't seen much discussion of the specifier and gender differences on the specifier specifically, but certainly there are a multitude of studies and papers written about how psychopathy presents differently across gender. And I'm not a big fan of the psychopathy specifier, which probably came across in my presentation, for a variety of reasons. And yeah, I think that if we say that psychopathy is only boldness, then potentially we do miss something when we're talking about women versus men, or probably a multitude of different demographic groups.
One final question here, because I know we are short on time. A number of people have asked about practical uses, especially related to, I think some people have mentioned sexually violent predator evaluations. So one asked, in New York SVP evaluations, there's a push by some to equate antisocial personality disorder and psychopathy by using the AMPD model. The logic is if ASPD and psychopathy exist on a continuum, then they can be functionally equated. The next step is that because ASPD alone is insufficient for SVP confinement, then psychopathy too should be considered insufficient. What are your thoughts on this?
It's a complicated question. I have a lot of thoughts on that, I guess, that I could probably do a whole other talk on. But yeah, I think that in my view, that if we move to this model, that we should rethink whether or not they are different, right? That if that in the AMPD, antisocial personality disorder is theoretically, and again, I think we need more research to demonstrate this, but I think is theoretically a lot more useful than what we currently think of as antisocial PD, and that it might, or that it does seem actually to way better equate with psychopathy. And so if we move to that system and people use the AMPD, then I think we're not necessarily talking about such different things there, right? I do think that because the AMPD focuses more on the characterological measurement of the personality disorder, which is kind of what was intended. I do wonder if you pit that against psychopathy as measured by the PCLR, that it's potentially not going to outperform actually the PCLR because it is more characterological and we lose a lot of the behavioral indicators there. But then I think it returns to this question of, are we most interested in psychopathy or are we most interested in these specific behavioral components of psychopathy? I know that didn't directly address the issue of SVP evaluations in New York, but I think it's a complicated question that we don't do ourselves any favors by currently thinking of the PCLR as psychopathy, right? And that we move to a new model with the AMPD, maybe they are more equivalent, at least on a broad conceptual level, right? Separate from the PCLR.
Well, Dr. Anderson, Jaime, thank you so much for sharing your expertise with us in psychopathy and personality assessment. I can already tell from the sheer engagement from the attendees, not just the amount of questions that we have here, but also the variety in different areas here. You briefly referenced there, oh, that could be a part 2. I think people are going to be clamoring for a part 2. So, but thank you so much for all your efforts here and for all the information you provided. It's been very helpful.
Yes, absolutely. Thank you for having me.
All right. And that wraps up this week's Law and Mental Health series. Next week, we have Dr. Troy McEwen, who'll be discussing recognizing and assessing stalking. We hope to see you then for another great discussion of issues in behavioral health and the law. Until next time.